would like, before we start with the program, I have some sad news and a moment of silence, I hope, for our dear friend and coalition member, Marjorie Waters. We just learned that this past weekend, Marjorie passed away unexpectedly. She was a warm, generous, but phenomenally strong woman. She served as a voice for people who were often not listened to and who often weren't prepared to speak for themselves. So I would love to ask for just a moment of silence to reflect on Marjorie, the work she does, and the work that we all do to make sure that Rhode Islanders and the people of the United States have a better life. Okay, thank you, everybody, and I am going to turn the program over to our coalition co-chairperson, Nina Harrison, who's the policy director at the Economic Progress Institute.
Thank you, Karen, and we'll definitely all miss Marjorie and her contributions and her smile. My name is Nina Harrison. I am the policy director of the Economic Progress Institute and the co-chair of the Protect Our Healthcare Coalition. I'd like to start this out by getting some of the ugly parts out of the way, which is a bit of grounding us in the reality of where we are. I'd also like to thank everybody for being here, especially our legislative champions. So right now, the reality is more than 300,000 Rhode Islanders rely on Medicaid. These include more than 160,000 children and parents, and over 50,000 seniors and disabled Rhode Islanders. That's about 1/3 of the state of Rhode Island. But despite the successes and popularity of Medicaid, Congress is currently moving through a budget resolution and reconciliation process which proposes $880 billion in cuts to Medicaid. It also proposes $230 billion in cuts to SNAP, which provides food assistance for 144,000 Rhode Islanders. In addition to this, enhanced premium tax credits, which are subsidies that help Rhode Islanders afford the insurance through the Affordable Care Act, are set to expire at the end of this year, which means that for many Rhode Islanders who don't qualify for Medicaid, that they can see really steep increases in their premiums and out-of-pocket costs for health coverage, which means some people may forego that health coverage, forego treatment, and ultimately it could mean a much sicker Rhode Island. These congressional realities are on top of the fact that in Rhode Island, Providence was just found to have been the least affordable metro area in the country, beating out even Boston and New York City, and that 68% of single adults and 78% of single parents with 2 children cannot afford to meet their basic needs. And that's according to the Economic Progress Institute's 2024 Rhode Island Standard of Need report. And so, when Trump and congressional Republicans are trying to gut critical programs and funding to critical programs like Medicaid to give tax cuts to the wealthy, we as a state have to stand up. We have to hold the line to protect Medicaid, and we have to put as many state laws in place as possible to protect Rhode Islanders from the serious harm that could come from these federal actions. So that's the bad part. The good part is we have a lot of solutions prepared to share with you today, solutions that will help protect Rhode Islanders on a variety of fronts, from more medical debt protection, which thankfully we were able, I'd like to thank the General Assembly for passing medical debt protection last year. We hope to expand on that this year. And including Medicaid defense, the Medicare Savings Program, and creating an affordability bill that will provide relief for people when the enhanced premium tax credits expire at the end of this year, so that they're not faced with a cliff and the tough decision of whether or not to buy groceries or buy health coverage. So these next speakers will talk to you about the proposals endorsed by the Protect Our Healthcare Coalition that are designed to help ensure that Rhode Islanders continue to have access to life-saving, affordable health insurance. I've been putting this in all of my speeches this year, that when we fight, we win, that as a country, we have a history of winning these fights in the past 248 years of winning fights for civil rights and equity and access to health care. We're so much closer than we were many years ago, and so I think we just need to keep the hope. And I'm confident because the policies we're proposing are also evidence-based, backed by research. And so when we can prove that these things work and they're effective and they're popular, it should be a convincing argument that members of the General Assembly and hopefully members of Congress will believe that and pass those policies. So next, I'd like to welcome back Karen Malcolm, coordinator of the Protect Our Healthcare Coalition, to share some stories with us about what people in Rhode Island are experiencing and why some of these programs and policies are important to them.
Thanks, Nina. I've been out in the community across the state talking to Rhode Islanders about their experience with healthcare. And needless to say, and no surprise to anybody, people's biggest concerns are related to cost, related to insurance barriers like prior authorization for what they seem to feel are simple prescribed treatments and services from their primary care doctors. But in addition to cost, people are really, really worried in this current environment about their Medicaid coverage and about even their Medicare and Social Security. At one of the community meetings a couple weeks ago, one of the participants let out a deep sigh and said, I guess what I can say is, I'm just relieved that when I checked my account this week, my Social Security payment was there. When people in the United States have to worry in this way, we've got a problem. But I'm gonna highlight a particular story, and that's the story of Penny Fitch. Penny is from Newport, and she's participated in a community conversation. And her story her experience, she and her husband's experience over the past 20 years, I think really captures kind of the storyline of most of what we're hearing from folks across the state. So I'm gonna read her story because Penny can't be with us. She's 80 years old, she lives in Newport, and getting to the State House, it just isn't accessible for her. So on her behalf, here's her story. My name is Penny Fitch. I'm 80 years old, my husband is 78, and we live in Newport. We've been Rhode Islanders for over 50 years. My purpose for sharing my story today is to tell you a little bit about the last 20 years in our healthcare experience, because it's been bumpy, to say the least. Access to affordable healthcare is something my husband and I struggle with today and have struggled with for decades. I was a bookkeeper and worked for companies that provided health insurance that covered both of us, because my husband's been self-employed for the last 35 years. It worked beautifully until I was downsized twice. At that point, we spent several years without health insurance, a very scary time. During that time, my husband needed hernia surgery. We went to our surgeon, who explained that surgery involved and how long the recovery would be, but my response was, I'm worried because we don't have insurance and I don't know how to pay you. He was understanding and kind and said, pay me $50 a month or whatever you can afford. Your health is more important than how you pay me. The surgery was successful, and we paid $100 a month on time regularly to pay down the debt. After 12 payments, the doctor's office helped find a charity that finally paid off the balance, which was sizable. This was a huge relief, and it gave us $100 a month to put towards groceries and rent and other things. This happened before the Affordable Care Act. If we had access then to subsidized coverage on Health Source, we would have been able to sleep at night. We wouldn't have had to be so fearful of my husband, who's a cabinet maker carpenter, having an accident on the job. Whether you're insured or have a big deductible or expensive copays, it's scary to worry about if you can pay. If you have to go to the doctor, you might put it off because of the cost of it all. My husband and I have always kind of lived payday to payday, so being uninsured was a difficult time. Even now, with Medicare, I was hospitalized for 9 days last April. When the bill came in, it was $4,000. I did everything but cry. $4,000 to us is just almost unbelievable to come up with. So I had to pay the payments. I scrimped and saved every little bit that I could, and my husband took on extra work on weekends to get it paid off in 3 or 4 months. We did it because we know what it's like to live with medical debt, and we wanted to get out from under it. But it isn't just healthcare affordability that we struggle with, it's access too. We've had 3 primary care physicians in less than 2 years, and so many of my friends are in the same situation. As of March 14th, we're not going to have any primary care physician. Luckily, we're able to see physician's assistants and other medical people to help with things, but it's scary to think that we don't have a doctor that gets to know us and can treat our whole body. It takes so long to get an appointment. I had to wait 5 months to get a spinal ablation last summer. And once I got it, I'm fine and it was wonderful, but to wait 5 months after you've been in pain for almost 6 months is very, very difficult. It's so frustrating to me to think that the leaders of our nation and the people we vote for that are supposed to look out for us and have such a wonderful health care at $0 aren't able to see what it's like for the thousands and thousands of people, no matter their age, that struggle with no health care or less than perfect health care. It just seems that in America, that's such an unfair thing to happen. And at the same time, it's frustrating because there really isn't anything that one person can do about it. So I'm delighted that you've asked me to speak because maybe in some tiny way, this will hit somebody's ears that can make a difference. Really, in Penny's story, we're hearing about the problems we have with our healthcare system and the lack of primary care doctors that we need. We're hearing about medical debt. Her story is even longer and includes stories about being declined by her coverage for simple procedures and medications prescribed by her doctor. And her story just represents dozens of others that I've heard in the community meetings that we've been having and are going to be continuing to have. So on Penny's behalf, I want to thank you for listening to her story, and I urge the members of our assembly to recognize this agenda as a path forward towards correcting some of the experiences that Penny and people like her are experiencing. Thank you.
Good afternoon. Thank you, Karen, for that, and thank you to Penny for sharing her story. I want to say thank you as well to Nina for getting us started and setting the context for us today. And I want to thank again Marjorie Waters for a career of tireless devotion to working for the less fortunate and for older Rhode Islanders with disabilities. She will be missed, and as I heard her say many a time, nothing about us without us. My name is Seamus Durak. I'm the Senior Attorney and Health Policy Analyst with Reichman and the co-chair of the Protect Our Healthcare Coalition. I'm here to take a brief moment to talk a little bit about one of our priority bills this year, which is the Rhode Island Individual Market Affordability Act, sponsored by Senator Lori and Rep. Speakman, who we have with us today, and we'll be speaking about it shortly. I want to come back to the context first, which is that when the ACA was first passed, and was intended to make coverage more accessible and affordable and meaningful for all, one of the ways that it did that was through the establishment of individual marketplaces like Health Source Rhode Island. We're thankful that the General Assembly has partnered with us and done considerable work to this point to protect much of the Affordable Care Act in state law. But there's still work to be done. Within HealthSource Rhode Island, coverage is available to people who don't have coverage through many other means, including people who weren't offered coverage through work, who are between jobs, where work coverage isn't affordable, where people just move to the state, or many other circumstances. And people use that coverage, both as routine coverage and coverage in times of transition. At any point, about 4% of Rhode Islanders, a little over 40,000 people, are enrolled in paid plans through HealthSource Rhode Island. But when you look over the period since the exchange was set up in 2013, over 160,000 Rhode Islanders, more than 1 in 7, have had coverage at some point. That's 160,000 people that before the Affordable Care Act would likely have been uninsured, or at the very least would have paid a lot more for their coverage, had coverage not through HealthSource not been available. Altogether, that's helped bring our uninsured rate down to a historically low 2.2%. And a big part of the reason that people can use their coverage through HealthSource Rhode Island is the affordability assistance provided by advanced premium tax credits and cost-sharing reductions at the federal level. There's always been some federal help since the Affordable Care Act was passed, but in 2021, acknowledging that affordable coverage was still out of reach for many, the federal government enacted what are termed enhanced advanced premium tax credits, supplemental assistance on top of the original ACA baseline. Unfortunately, if Congress doesn't act, that additional assistance will expire at the end of 2025. So what does that mean? $40 million in subsidies currently coming to Rhode Islanders will go away. $40 million. Many people's premium costs would skyrocket. We've got a couple of examples here for a baseline plan. A 64-year-old couple making $85,000 a year combined would see their share of the premium go from about $600 a month to about $2,000 a month. That means that 28% of their household income would go to just paying for their monthly premium. That's before any out-of-pocket costs for services, before any like their deductibles, which are rising every year, 28% of their income just to be able to buy health insurance. A 45-year-old making just over $27,000 a year would see their share of their premium increase 387%. Right now they're paying $23 a month for a baseline plan. After the enhanced advanced premium tax credits expire, that'll go up to $112, an almost fourfold increase. For many people, they'll be unable to afford coverage, and they'll go uninsured. The Federal Congressional Budget Office estimates that nearly a third of people currently enrolled in HealthSource would drop off. Many of those people have no other options for insurance, and those who do stay enrolled would have to pick skimpier plans that offer lesser coverage, would have higher out-of-pocket costs, and we would expect to see a significant increase in people not getting the care they need when they need it. That'll have detrimental effects on health and the ability for people to work or live full lives. So what can we do? If Congress doesn't act, we need a state solution. The Individual Marketplace Affordability Bill, sponsored by Rep. Speakman and Senator Loria, would create a state-based affordability program that would replace the expiring federal financial assistance and keep people in affordable coverage with no impact on general revenue. Financially, this is done through a small, estimated at 1% assessment on other forms of health insurance in Rhode Island. HealthSource operates as a backstop for every other type of insurance in the state, and spreading the costs around the system was identified by a stakeholder work group convened by HealthSource Rhode Island as the fairest way to shoulder that cost. This then creates a state program that can replace the existing federal tax credits in their entirety, helping keep our lower and middle income friends, family members, and neighbors in affordable health coverage. I want to pass it over to Senator Loria first and Representative Speakman to share a little bit about why they support this legislation.
Thank you, Seamus. So this is actually personal for me. I have been a primary care nurse practitioner for the last 27 years, which means before the ACA was passed, and certainly before the enhanced benefits were passed. So I remember what it was to have patients that could not afford health insurance and what that meant to their health outcomes. I remember women that couldn't get their mammograms or their pap smears, and we found their breast and uterine malignancies late and what that meant to their health. I remember individuals that couldn't afford their colonoscopies, so we found any of their colon malignancies late and what that meant to their health. I have helped people make decisions about which medications they can or cannot afford, having to decide whether or not they can do and see that specialist because they can't afford it. This is personal for me. We cannot let that happen again. We cannot let people go over that cliff and have to make those decisions. I can't remember the last time I had to have that conversation with someone, and I don't want to do it again. These are, a lot of the people that take advantage of these programs are actually the most fragile of our population. And imagine the diabetic that can't get their insulin, or the person with high blood pressure, or what the years of not taking those medications would mean. That's why this is personal to me, and it should be personal for everyone. And it's not just the right thing to do, which it certainly is. It's also the economically smart thing to do. Because you know where those people had to go when their outcomes were poor? I had to send them to the emergency room. Do you know how much cancer costs when we catch it late? I do. I've seen it. So this needs to be personal for everyone. We cannot let these people go over this cliff. I deeply hope that our federal government does the right thing. I'm deeply concerned that they will not. So please, let's get this done. Thank you.
Hello, everyone. Thank you to Karen and to Seamus, and I am sorry for your loss, and to the Coalition for their tireless work on this very difficult but essential task of ensuring that Rhode Islanders have access to affordable health insurance and affordable health care. I've worked with them for a couple of years now. This is so complicated, so many pieces to fit together, and they are so smart and committed and diligent, and we all owe them a debt because of their commitment to solving, if it's possible, this problem. So thank you so much. And I also want to thank my House and Senate colleagues who support this work and join in this work. I see Viagello here. It's nice to see. I saw Senator Ujafusa. I see Senator Valverde. And I'm sure there are others here. There's a big light there. So, as we've said, what's happening in Washington is exacerbating the inequities that we all know exist and pushing more Rhode Islanders into financial distress. As elected leaders, we have a responsibility to push back and to make Rhode Island a leader in doing all we can to meet the health care needs of our residents. This bill that Seamus was talking about, the Marketplace Affordability Act, addresses the chilling effect that will be created if the enhanced premium tax credit program ends. And it integrates other recommendations supported by the Coalition to ease costs, improve access, and stabilize our workforce, creating a path toward affordable, accessible health care despite what's happening in Washington, D.C. As Nina said, when we fight, we win, and this is a fight that is worth fighting. So thank you all for your support. Thank you.
And thank you, Rep. Speakman.
Thank you, Senator Laurie and Rep. Speakman. Thank you both for your continued partnership. And thank you to the other members of the General Assembly for working with us as we advance access and affordability for Rhode Islanders in accessing meaningful health coverage. I want to turn now to a couple of other high-level priorities for the Coalition this year. Medical debt and the excessive use of prior authorization. These are two of the things that we hear about the most when we speak to community members about the difficulties they face in getting the health care they need. And there are some important proposals in the session that could make meaningful progress on both of those fronts. Medical debt is a pervasive issue, both in Rhode Island and nationally. In 2022, the Consumer Financial Protection Bureau reported that 1 out of every 5 Americans reports having unpaid medical debt. More than half of consumer accounts and collections are medical debt. Medical debt contributes to more than half of personal bankruptcies, and almost half of people with medical debt report avoiding medical care, resulting in negative downstream health effects. But unlike other forms of consumer debt, medical debt is almost without exception traceable to unexpected medical expenses, not to affirmative financial decisions made by consumers. Rhode Islanders with expensive conditions do not choose their diagnoses, and constantly increasing premiums, deductibles, other out-of-pocket costs mean that the issue posed by medical debt increases every year for low and middle income Rhode Islanders. And this is a health equity issue too. I said 1 in 5 Americans reports medical debt. That number jumps to 2 in 5 households with incomes below $50,000. Black and Hispanic households report higher rates of medical debt than white households. After the Assembly successfully passed H 7102 sub A last year, all right, after the Assembly successfully passed H 7103 sub A last year, which stopped credit reporting and established collection standards, the Coalition is supporting two pieces of partner-led legislation this year addressing medical debt. H 5184 by Representative Shellcross Smith and S 169 by Senator Kasselian would prohibit property liens and wage garnishment, and H 5235, again by Representative Shellcross Smith, and S 172 by Senator Burke, would cap interest on medical debt. H 5235 is being heard in House corporations as well today. Turning now to prior authorization, the practice by which health insurers have to approve a medical service before it's performed in order for it to be covered by insurance. This was the #1 issue that Rhode Islanders raised in recent focus groups convened by the Protect Our Healthcare Coalition that Karen conducted when they were asked about the obstacles that they find to accessing the care they need. It's also something that puts intense administrative burden on our healthcare providers, many of whom have had to bring on dedicated staff just to navigate prior authorizations. Prior authorizations fall particularly hard on primary care providers and behavioral health care providers who are already strained to the maximum. And the process of navigating prior authorizations is frequently pointed to as one of the top causes of provider burnout. And with the expansion of AI and machine learning into the healthcare field, some insurers have started relying on AI to make prior authorization determinations. This is a brand new horizon without meaningful guardrails in place. Could represent a significant threat to consumer access to care. But there are several good bills this year to address prior authorization. I'll highlight two of them. H 5120 by Representative Potter, and S 53 by Senator Fusa, and S 168 by Senator Murray would reduce the barrier of prior authorizations in primary care, and H 5172 by Chair Donovan and S 13 by Senator Fusa would regulate the use of AI in prior authorization determinations. I want to thank you all again to the members of the General Assembly and to everyone who's attending today for your continued partnership with us. We hope you'll support the Coalition's work on affordability for people who have coverage through HealthSource Rhode Island, on our work on medical debt, and on prior authorization. I'll turn it over now to Michaela Carroll from Rhode Island Kids Count, who will talk about some other important affordability and access recommendations from the Coalition agenda. Thank you.
You can take question.
Thanks, Seamus, for those remarks. I'm Michaela Carroll, and I'm the Health Policy Associate at Rhode Island Kids Count. I focus on health policies affecting children and families. When we improve access and quality of care for our most vulnerable populations, we improve it for everyone. The Protect Our Healthcare Coalition supports every Rhode Islander, including trans Rhode Islanders, immigrant Rhode Islanders, disabled and senior Rhode Islanders, and Rhode Island children. Grounded in this framework, we support a path forward for improvements in healthcare access, healthcare affordability, healthcare system quality, and healthcare justice. This path has many building blocks. For our seniors and people with disabilities, Medicare costs are too high, which means some people skip getting treatment and services they need because they just can't afford it, which you've already heard about today. That's why the Protect Our Healthcare Coalition, with our partners in the Senior Agenda Coalition, supports expanding the Medicare savings programs to help lower-income Rhode Island seniors and people with disabilities cover their Medicare premiums and, for some, their out-of-pocket costs. The goal is to make these programs stronger by raising the income eligibility limit and eliminating the asset test for participation in the program to improve access to care and affordability. We're grateful to our legislative sponsor, Representative Alzate, for sponsoring this bill. For our youngest Rhode Islanders, infants and toddlers under age 3, more than half of whom are enrolled in Medicaid, the Coalition supports continuous Medicaid coverage. This bill will make sure that infants and toddlers under age 3 don't lose health care coverage due to the administrative burden and paperwork so that they have undisrupted access to the care and support that they need to grow and develop. We're grateful to our legislative sponsors, Representative Slater and Senator Loria, for sponsoring these bills. For the many Rhode Islanders who struggle with mental health and substance use disorders, we support bills to strengthen mental health parity rules and to fix the prior authorization barriers, which we just heard about, that so many people with chronic behavioral health conditions experience. We appreciate the support of the legislative sponsors who are champions for mental health parity, including Senator Fusa and Representative Tansey. They're also working hard to advocate that our behavioral health professionals are adequately reimbursed by commercial insurers for the work that they do. We also support addressing low reimbursement rates in commercial coverage. And then, to ensure access to quality behavioral health support for children and perinatal Rhode Islanders, we support sustaining funding for the PDPRN and Moms PRN programs, which are psychiatric resource networks that offer telehealth consultation to providers so they can help bring whole care to their patients. We're grateful for the support of Representative Shaw Smith and Senator DeMario who are sponsoring these bills. But making sure that people have affordable quality health insurance is only part of it. If a patient with a card in their pocket can't get an appointment when they're sick or in pain, or they have to wait months for a well care visit, there's more that we need to do. That's why we support efforts to stabilize and build our state's primary care and behavioral health practitioner workforces, including by expanding the Rhode Island Health Professionals Loan Repayment Program, funding other healthcare workforce programs, and by rebalancing payment systems so that our primary care professionals, including pediatricians, can stay in practice. We're grateful to Representative Fogarty and Senator Pearson for sponsoring these bills. And also to support those who care for our seniors and disabled neighbors living in assisted living and nursing homes. We support the Nursing Home Workforce Standards Board, the Rewarding Quality in Nursing Home Care Act, and legislation that demands more financial transparency from for-profit nursing homes. These bills will help ensure fair wages for caregivers and that state and federal Medicaid dollars are appropriately directed to improve patient care. We're grateful to Representatives Slater, Potter, and Speakman, and Senators Valverde and Thompson for sponsoring these bills. As a coalition, we support healthcare equity and justice. To speak more about justice and the social determinants of health and how we can support all Rhode Islanders, I'd like to introduce Dominique Resendez from the Central Health Providence Equity Zone.
Good afternoon, everyone. My name is Dominique Resendez, and I'm with Central Providence Opportunities, a Health Equity Zone. We are one of 14 health equity zones statewide. As we've heard from the other speakers today, the issues we are facing in Rhode Island's healthcare system are not just about affordability and access, but also about equity. We know that our ability to lead healthy lives is determined by where we live, not just by our experiences at the doctor's office. To be healthy, we need nutritious food, clean water, safe, affordable housing, decent public transportation, and strong connections with our communities. That's why these issues are represented in the Protect Our Healthcare Coalition's legislative recommendations as a path forward for every Rhode Islander, and why we are a proud partner in the coalition. At the Health Equity Zones, we focus on securing these things for the most vulnerable among us, knowing that this will uplift and serve all of us. That means making healthcare safe and accessible for immigrants, regardless of their legal status, so that they can address their medical needs without fear of deportation. That means voicing and sustaining support for our trans neighbors, so that they know gender-affirming care is and will remain available to them in Rhode Island, despite what may happen elsewhere. This is equity work. We use reliable data to ask who is most at risk, and we work with them to change our systems. With this in mind, the Rhode Island Equity Zone Act, which has been submitted for review and is awaiting a bill number, would codify the Health Equity Zone network into law, into Rhode Island state law. We are proud that this is a legislative priority for the Protect Our Healthcare Coalition. As we work to improve Rhode Island's healthcare landscape, we must and will maintain this lens. Thank you to all the members of the coalition and the legislators who are working together to build a healthier Rhode Island for all. Now, I'll turn it back over to Nina. Thank you.
Thank you, everybody, for sticking with us through this program. We've heard a lot about several important proposals, and many of them, as you may have suspected, require funding. You may have also heard that we have a budget deficit in this state. But one of the ways that we can fight back and make sure that we're really protecting ourselves as a state and ensuring that we have as many resources as possible to protect ourselves as a state is to pass Rep. Elzate and Senator Murray's bill to raise $190 million in revenue annually by taxing the top 1% of income earners in Rhode Island. As it says, that's 1% of Rhode Island tax filers, so only about 5,700 households would be affected, and that would benefit the more than 1 million Rhode Islanders who live in this state, including to fund programs like we've been talking about today. So that $190 million could be used to fund the Individual Marketplace Affordability Act. That would ensure that up to 46,000 Rhode Islanders don't have to lose their health coverage because they can't afford their premiums, which will likely increase when those tax credits expire at the end of this year. That $190 million could also be used to expand the Medicare Savings Program, which primarily benefits seniors and the disabled. Or it could be used to fund continuous Medicaid coverage for children from the time they're born through the time they're 3, so that there's no disruptions to their care, their medical care in those critical early years. These and more, this money could use to fund these programs as well as the other initiatives that are on the Protect Our Healthcare Coalition's agenda. With that in mind, I said when we fight, we win, so I'd like you to join us all today to help begin this fight by lobbying on the floor of the House and the Senate. We have our legislative agenda here for the Protect Our Healthcare Coalition with all of the bills that we've talked about today on the front and back. And our Tier 1 priority is the Individual Marketplace Affordability Act that you've heard about today. But whatever of these priorities resonate with you in your community, please join us on the floor to tell all of the representatives and senators that you see why these are so important and what a difference they would make in your lives and the lives of your communities.